People living in Donbass do not have regular access to medical care.
Вызвать машину скорой
Calling up an ambulance to a settlement near the contact line is a real problem.
помощи – настоящая проблема.
Wrecked roads, outlying settlements, and ceaseless shelling. Family physicians deliver medical aid at their own risk.
In fact, the dispensary is missing out here. Moreover, not even a first aid station.
People are rescued by military medics. They're never far away and ready to help.
These wonderful people.
We are living as a neighbor with a neighbor. In everyday atmosphere, we are trying to live in a way that would be neither service nor war, so that there would be just a little bit of common humanity. Why do doctors give up working in Donbass?
It's a scary thing. They don't want to. There are better prospects in the rest of Ukraine.
Без больницы и аптек.
With no hospitals and pharmacies, and even the ambulance doesn't arrive here. This is how healthcare looks like in the communities close to the contact line. People do not have regular access to medical care, so quite often the only professionals people can rely on are Ukrainian military doctors.
Военные медики.
The village of Zaitsevo is located right near the contact line. It is controlled half by the Ukrainian army, while the other half by illegal armed groups. During the day it is quiet, and at the night it gets into the shootouts. Once a month, Valeria Leonova, a family doctor, comes here. She always tries to see people before dark, to have time until the shooting starts. One of the households in Zaitsevo, where nobody lives in, was converted into a temporary hospital, with one of the rooms used instead of an office. What do you carry?
My favorite is a blood pressure monitor and a phonendoscope. Because you can't do anything without it. The rapid test kit for coronavirus, because if we have any signs of acute respiratory infection, we should always check people for a coronavirus. If in the past this disease was not so common, then now even a simple runny nose can turn out to be a COVID.
Not all the patients want to be filmed, and some refuse to talk to journalists. They are afraid that their relatives from another part of the village are likely to get in trouble due to this. The only person they trust is Dr. Valeria.
If she is here, so be I here too, and I don't move any further. Yes, I come here according to my need every time, because I can't walk any further. Here we have a wonderful doctor. She can do all the appointments, check everything up. I know for sure that everything will be fine.
Я надежно знаю, что все будет в порядке.
Кислород хороший. 98. Кислород очень хороший.
Вызвать машину скорой помощи сюда, в населенный пункт, который...
Calling an ambulance to a village near the contact line is a real problem. In addition to the fact that the roads here are damaged and it takes quite a long time to drive on them.
Есть проблемы со связью.
There are also issues with communication, and one has to climb high ground to find a signal.
Еще не гарантия того, что кто-то к вам доберется. Ведь если помощь понадобилась...
But even that is not a guarantee that someone gets to you. In fact, if assistance is needed in the evening or at night, it is unlikely that someone comes, as the night is time of shelling.
Попросту опасно.
Despite all her fears, Valeria comes here time after time, because she is someone the locals can rely on.
In fact, the dispensary is missing out here. Moreover, not even a first aid station. By the efforts of local residents, volunteers, activists, here is organized such a common center where all the activists of the village take place. A lot of social issues are solved, and in particular medical care is provided. As a family doctor, I receive patients here once a month. However, sometimes there is a need to make more. If some person feels bad at home, we have to come more often. That is, the ambulance comes. But for this, it is necessary to call a lot of times. We do not always get to Donetsk region, sometimes we end up in Luhansk region or even in non-controlled territory, meaning quite usually the call is redirected.
Despite all the tribulations of the job, Valeria managed to achieve an incredible vaccination rate in the Frontline community. 95% of the residents are vaccinated with 2 doses of the coronavirus vaccine.
When we received a sufficient amount of coronavirus vaccine, I put the question rather harshly here. There were elements of coercion. But we did well. Zaitseva is 95% vaccinated. This is probably the best performance in the area. There certainly are few people, but nevertheless are persuaded. Mobile teams vaccinated at home and here at these sites. So the percentage is now very good. So it's a little bit easier to sleep.
Valeria is one family doctor for the residents of 5 settlements along the contact line. She says doctors do not want to work in this area. Despite the decent wages, doctors are reluctant to work here mainly due to insecurity. The area lacks 8 more doctors, but Valeria would be happy to have at least one.
It's a scary thing, they don't want to. There are better prospects in the rest of Ukraine because now the newly formed territorial communities sometimes are able to pay more. Well, again, if it's the Kyiv region or the Vinnytsia region, the living conditions are probably more attractive there. The young specialists here is paid minimum wage and an equal bonus above it, which amounts some $450 in total. And once one signs enough patient declarations, the sum rises up to $625. So now $625 is the maximum salary for a family doctor here.
Along a road, shattered in the course of combat actions, we are heading to another settlement in the Donetsk region, the village of Travneva. Travneva village is right on the contact line, located just a few kilometers from non-government-controlled Horlivka. The first trenches begin just past the vegetable gardens of local residents. This is the single road that goes into the village and is subject to constant shelling. Therefore, the village is virtually cut off from the outside world. Due to the constant shelling, civilian medics do not even come here during the daytime. Therefore, after his night duty, military medic Alexander, with his backpack, goes to the locals through the wrecked village streets. And every time he visits Maria Andreevna.
Those doctors, they come all the time asking, what do you need? Well, what should I say? Bring me youth, take away old age. What can I do? Measure what? These lads help me. It's not just the guys, all those who visit me. They're my sons, my treasure people.
Maria Andreevna is one of the few residents of the village. She worked as Ukrainian language teacher for 30 years in Horlivka city. Now she lives here near the line of contact. There are no stores or pharmacies in the village. That's why she has to pass several dozen kilometers away to the nearest town to get everything she needs, each time by the taxi.
There is a bus and people appoint in advance, only once a day on Fridays, because a lot of people will come.
Do you need to make appointment?
Yes, you may, but I don't go there. Feet hurt a lot.
Is this the only way to get into town?
Either this way or you have to have your own car or take a taxi.
And how much does it cost to hire a cab to the nearest town?
It's Bakhmut and it's expensive.
And how much does it cost?
People chip in some $8. I pay more as I usually take it alone.
Alexander tries to see his patient at least once a week. He remembers both her pulse and her blood pressure. When she gets worse, then we know exactly what happened, what drug to prescribe, what to recommend. If we have pills, then we give them. The area here is practically locked. For the people who stayed here, the only medical access they have, this is through us, through the military doctors. And we do all the best. I appreciate people's positive attitude towards us. Some cereals we can share. Nothing is too difficult for us too. Sometimes bread. And sometimes it happened that we do not have something. Andreevna tries to help back in some way. This is a team effort. We live as neighbors. In an ordinary environment. We try to live as if there were no service or war. Just sharing humanity. To escape from those duties, to forget about them for just 10 minutes. To drink a cup of tea together and chat. It makes everything easier. However, Maria Andreevna admits that she tries not to complain too much.
Health issues resulted from old age. I can't complain about old age. Old people have once aged and died. It's just a matter of age. Everything hurts for old people. What am I going to complain about? Okay, give me a pill or an injection. What's next?
Before the war, Alexander graduated medical college and worked as a paramedic. He has been serving in the Donbass since 2014. The level of proficiency of military medics increased significantly since then, he says. Thanks to the bitter lessons that were learned in those years in 14-15, we were trained to provide first aid. There is a very high-quality training. A medic being dropped into the field has only 2 shoelaces, boots and a cap. He is able to deliver such an aid that a person will be brought out of the battlefield and will survive. The main task of Frontline doctors is to provide first aid to a wounded soldier and to transport him to a safe place where he can be operated, for example. The military hospital in the city of Pokrovsk is one of such places. Our task is to provide emergency medical care to servicemen from the area of our authority. They may be wounded, injured, or maybe soldiers with systematic illnesses who come to us as members of the brigades and battalions. Here, qualified medical care with elements of specialized care is delivered. After the condition of the soldier is stabilized, he is sent to the higher levels of medical care if necessary. If not, they receive treatment until they are fully recovered and return to units to continue their service. Victor, the hospital's chief surgeon, says that most of the patients admitted are soldiers with bullet wounds or injuries caused by mines and missiles. There were soldiers with abdominal wounds, chest wounds, there were soldiers with limb injuries. Also, thanks to the fact that we have diagnostic equipment, we are able to perform low-invasive surgical operations, which fastens the recovery. Residents also come to the hospital to get aid from the military doctors. Quite often, this is the only option for them, as there are simply no doctors in the contact line settlements. Most often they come to us in acute conditions, with stomach or vascular problems or neurology. Because they know that we have equipment. After all, they are aware that the military hospital is here. People can contact us. Additional benefits for the work in combat conditions. This is what could be helpful and attract civilian doctors to Donbass.
Unfortunately, there are no additional payments. This question has been repeatedly raised at different levels. Doctors do not have the right to wear military personnel protective equipment. We have only a mask and a gown, and not allowed to wear helmets and bulletproof vests, although those districts like Travnevo, Hladosovo, Zhovanka, there it would be possible. And also the topic of the status of a joint forces operation participant for medical workers. This question also repeatedly raised. Still little progress is done. Maybe if such a status would have been granted, at least for the period of hostilities, they were more willing.
Until then, we have a salary, which is as elsewhere, and while temporary housing, still willing few.
We have comfortable housing, transport, the prospects of training, internships, perhaps even abroad, contract-based very high payment. We're ready to pay the maximum even without a declaration, immediately from the start. Well, we can even come up with something further. So, as you have probably heard, there will be a salary increase started from the new year. Payments for doctors and nurses will be raised by $250. So up to 20 and 13,000 hryvnias respectively. Conditions also improving. Svitlodar military civil administration has adopted a so-called stimulus program committed to provide young specialists with housing and perhaps free transport. That is, we do have opportunities. The only obstacle is lack of desire among my colleagues.
20-year-old Ksenia is one of those people who came working to Donbass by her desire. She's here for the first time, not as a civilian doctor, but as a military one. Ksenia dropped out of a medical school and signed a contract with the armed forces of Ukraine. She says she wanted to feel proper. Civilian medicine was not enough for her.
I was a medical student, and just the same I was thinking about joining the army because here help is needed. The practice in civilian medicine be like so much time for the assistance to be delivered, so that most probably patient to regret he has ever come. Here moral support is vital. In civilian life you will not approach your friend with the words, "Oh, please, give an injection," or "Can you measure the pressure?" Say a pill, maybe something else. They won't even turn to you with this, and it's not a fact that they will come to the doctor with this.
Ksenia admits for a year in service, she got known more than for 2 years in college.
Catheterizing is not even in program of the civilian medicine. One might learn in only after start working in hospital. If you ask the workers, they can show you, or thanks to the practical lessons in college.
Ksenia has already received her first combat experience. She saved the life of her colleague.
Это было пулевое ранение. И поступает звонок с информацией просто, что
It was a bullet wound.
один
There have been no details in call except someone has been wounded.
ночью вслепую разрезали,
A
затампонировали.
guide was a school principal. You rush in nowhere, climbing and crawling the best weights. Then you see a person, freeze for a second, finally realize that he's the one you ought to help.
Эвакуация. Я помню начало, и потом, что уже все.
He started bandaging, and very soon the rest of medical team appeared, performing swiftly.
С таким же ступором, что произошло. То есть осознание пришло потом.
New bandage, injection and evacuation. Only afterwards I have realized what had actually happened then.
А потом ты начинаешь еще больше понимать, где ты находишься.
Ksenia says that when the contract ends, she wants to teach medicine to children.
Ну, пока это, конечно же,
Well, for now, of course, this is a contract. We will see how it turns later. Maybe in general, I mean the Sokil Jura program for school children, so that at least teenagers knew what it is.
хотя бы знать,
I'm still grateful to my teacher that gave some of the skills.
что это такое. То есть я до сих пор благодарна своему учителю за то, что она нас гоняла.
Every year, more and more young doctors prefer joining the army, where they can receive decent salaries and additional benefits. Civilian medicine in those areas, which are commonly called the gray zone, rests solely on the shoulders of enthusiasts. State support is not the decisive factor here. Amid a very real danger, civilian doctors are fighting with irreversible, prolong the lives of those remaining in the shadow, somewhere between peace and war. Who will replace these desperate doctors, and when will it be possible to drive along the streets of Zaitsevo and Travneva without fear? The question of time and price. Reported by Alexander Makhov, specially for UATV.